As I promised, here is a video based on the chapters from the text Community as Partner. This will help you as you work on weeks 3 and 4 to do your assignment. First, I thought we would start with a definition of community. Community is a group of people that interact and support each other and are bounded by shared experiences or characteristics, a sense of belonging, and often by their physical proximity. This is a very broad definition and may include any community. For example, SXU graduate program could be considered a community, or the healthcare system in which you work could be considered a community. We'll discuss this in a bit on how you should choose your community for your assignment. Models provide a framework for understanding a phenomenon. For this assignment, we will be using the Community as Partner model. This is based on Newman's system model. A system model in which each part interacts with each other and is a whole. The model consists of two parts, the community assessment wheel at the top, the center of which is the people, including their demographics, values, beliefs, and history. Surrounding the central core are the subsystems of the physical environment, education, safety and transportation, politics and government, health and social services, communication, economics, and recreation. These are the areas in which you are going to assess about your community. The second part is the nursing process, which includes the community diagnosis, planning, and interventions, either primary, secondary, or tertiary prevention, and finally evaluation of the intervention. And this is a snapshot of what you're going to be doing for your paper. Now, the most critical piece for this paper is to choose your community. Although you may choose any community through using our definition, choosing a village or city would be the best, since some of the questions in your community assessment template ask for information that can only be gleaned by looking in places where people live. Now, choosing the city of Chicago would be much too large. You would spend months, possibly even years, gathering information. So I suggest if you live in Chicago that you pick one of the neighborhoods in the city. For both the suburbs and the neighborhoods of Chicago, I found valuable information from the link below the pictures. Otherwise, you can go to the internet and find information on your city, village, or neighborhood. Mostly, it is important to pick the correct size and a place with which you are familiar in order to finish the assignment in a timely manner. For the next few slides, I chose Woodridge, Illinois, which is the village in which I live, and actually it resides in DuPage County. Now, learning about a community's history gives you a sense of what the community is about and how it has evolved over time. For instance, using Woodridge as an example, it lies in between DuPage and Will counties and is 23 miles southwest of Chicago. Native Americans inhabited the land until about 1833. Pomeroy Goodrich and William Green were farmers who settled in the area, and after that, Woodridge remained a farming community until the advent of the railroad. It was a secluded community up until after World War II, when the post-war boom of housing began. Schools and a library were added in the 60s and 70s, but Woodridge does share a high school with Downers Grove, which is a neighboring community. It was incorporated in 1959. The information about Woodridge was found on the website listed on the slide, and also more information on the internet. What you can glean from this is Woodridge is actually a younger community and grew during the post-war World War II period. Now, as far as age and gender, there are some key stats from 2023. Woodridge's population under age 18 was about 22.9% compared to 22.5% nationwide. Its working population, ages between 18 and 24, was 65.5% compared to nationwide 61.4%. The elderly or senior population over age 65 was 11.5% as compared to 16.4% nationwide. This information was found searching the internet for age and gender for Woodridge, Illinois from a Nielsberg.com. When making inferences, it is always helpful to have a comparison, such as Nielsberg did for Woodridge with age and gender. In this case, Woodridge is a young community as compared to the nation. Inferences would be that it needs to focus on the needs of a younger community, for example, through recreation and school. Now, we also want to know about race and ethnic groups within a community. As you can see, Woodridge is mostly white, although it has dropped in 2020 from in 2010, where it was 63.5% white, down to 58.2%. If we look at the African American population in 2010, it was 8.67%, where in 2020 it went up to 9.8%. If we look at the Asians, they've gone from 12.41% in 2010 up to 13.23% in 2020. And Hispanics have gone from 13.42% in 2010 up to 14.8% in 2020. So as before, to do an analysis for community diagnosis, you need some kind of reference. And what you can see is that Woodridge is becoming more diverse. Some other information that would probably be useful that comes from Nielsberg is that Woodridge population reached its peak in 2020, which is about 34,109 people, up to now, which is the years between 2000 and 2022, where the population dropped to 30,965. What you might be able to glean from this is perhaps the tax base is lower, and that may impact the village's ability to provide services for its residents. Now we also want to look at the vital statistics for Woodridge, including birth rates, death rates, and leading causes of death. The birth rate for DuPage County for 2021 was 10.7 births per 1,000 people. And you get that number by dividing the number of births divided by the population. Again, it's better to have a comparison, so the birth rate in 2020 was 10.2 births per 1,000 people. The conclusion is the rate is ticking up. However, if you look back over the past 10 years, it has dropped off. The death rate, using the same formulas, except for using number of deaths instead of births, for 2021 was 7.57 deaths per 1,000 people, where the death rate in 2020 was 8.3 deaths per 1,000 people. So you may conclude that the death rate is down. The leading cause of death is heart disease. They had 7,624 deaths in 2021 to be attributable to heart disease, while in 2020 it was cancer, but only by a few more deaths. I was interested in looking at opioid deaths for the county. There were 114 overdose deaths in 2023, with an increase in non-opioid drugs, especially cocaine and prescription medication, causing or contributing to death. Though a reduced number of overdose deaths in 2023 is positive, from the 150 it was in 2022, the epidemic of opioid and other legal and illegal drugs continues to ravage the county, and the types of drugs found in the blood of the deceased remain similar to the previous 2 years. A significant trend is a continued decrease in heroin overdose deaths, while fentanyl remains a major drug causing death. The greatest concern is the return of carfentanil in DuPage County. This isonomer of fentanyl is 10,000 times stronger than morphine. It is an extremely dangerous drug for users and extremely hazardous to those who may come in contact with it, including first responders, EMTs, and treating personnel. So the opioid crisis may also be of concern to Woodridge. Next, we want to look at housing, which are the number of housing units available and household size. This data is from the Community Data Snapshot of 2021. The number of unoccupied housing units in Woodridge was 492, with a total number of occupied units being 13,081, which means it's 96.4% occupied. Owner occupied was 8,329 or 73%, and renters were 4,752 or 36% for the years between 2017 and 2021. In DuPage, the occupancy was 95.4%. Owner occupied was also 73%, but the renters were at 26%. Home ownership actually increases a family's wealth, and the families tend to have health insurance and so better access. Also, kids stay in school, so do not move around, leading to a better education. Therefore, 36% renters in a community may be a problem. Now, the Woodridge household size, for one-person households, it's 3,350 or 25.6% of the community versus DuPage's 24%. Two-person household was 4,274 or 32.7% versus DuPage's 33%. Three-person household was 2,133 or 16%. DuPage County also had 16%. And a four-person household was 3,324 or 25%, which was the same for DuPage County. Household size has implications for financial stability of the family, psychological well-being, and resource usage. Now, the median cost of owning a home or buying a home in Woodridge is $406,000, which is up 33.6% over a year. In Downers Grove, which is a neighboring community, the median cost of a house there is $469,000. It was only up 17.3% last year, and that was from Redfin.com, which is a realtor agency in the area. As far as rentals go, the average cost of renting in Woodridge is $1,430 versus the United States average rental is $1,516. And those figures were from apartment.com. Looking at healthcare facilities, including hospitals, clinics, hospice, emergency care, private practitioners, and the percent uninsured, there are actually 4 hospitals in the immediate area of Woodridge within 2 to 3 miles, but none within the village limits. General hospitals include Adventist Bolingbrook, Edwards, which is part of the Endeavor system, Advocate Good Samaritan, and a psychiatric hospital, Linden Oaks, which is part of the Endeavor system. Woodridge has several clinics, including MyCare Express, the Woodridge Medical Center, Dooley Healthcare, and Endeavor Walk-In. There is hospice care, for which I could find numerous agencies, but none located right within the village limits. For emergency care, residents can go to Adventist Bolingbrook, which is a level 2 trauma center, and Edward, which is also a level 2 trauma center. But Advocate Good Samaritan Hospital is actually a level 1. Level 1 is the highest, which means they have all the essential services that are in-house and are available 24 hours a day, which with level 2, there are some essential services available 24 hours a day, but not all. Most healthcare providers are part of the healthcare system, such as Endeavor Health and Dooley. 92.3% of the population of Woodridge has health coverage. 62.4% are employee plans, 10.4% on Medicaid, 10.1% on Medicare, with 8.95% on non-group plans and 0.4% on military or VA plans. In 2023, only 8.6% of the population was without health insurance, where 6.7% had disabilities. Next, we want to look at public health and home health services. There is actually a Southeast Public Health Center, which is located in Westmont, Illinois, which is a village that is fairly close, but not right next door. It has departments for behavioral health services, better birth outcomes, environmental health services, family case management, health insurance benefiting services, HIV prevention programs, immunization services, sexually transmitted diseases, program vital records, and women, infants, and children. As far as home health care services, there are numerous agencies from which to choose, and the DuPage County Department of Community Services Division of Senior Citizen Services is able to help make decisions on care, and that's located in Wheaton, Illinois. As far as social service agencies, there's the Family Community Resource Center that is located in Naperville, Illinois, and there residents can apply for health care, food, and cash assistance. And then again, there's the Southeast Public Health Center in Westmont, which we discussed in the prior slide. Moving on to long-term care, there's only one independent senior living center in Woodridge, which is named Woodridge Horizon. It does supply security, but no dining services. It's basically an apartment building for seniors with some amenities, which the site lists as large and comfortable lobby area, kitchen and a multi-purpose room, arts and crafts room, a game room with a billiards table and TV, a theater room, a living room with a fireplace, a library, daily recreational activities, an outdoor patio with grill, and on-site property manager and live-in manager. There are numerous other senior living arrangements, including nursing facilities that include assisted living up to dementia care, that are in the suburbs very close to Woodridge. Moving on to economics, you can see that the per capita income was $48,262, which is a little higher than the amount in the Chicago, Naperville, Elgin area, which was $45,977. The median household income was $95,756, which is 10% higher than the Chicago, Naperville, Elgin area, and about 25% higher than the amount in Illinois, which was $78,433. People that are considered under the poverty line are 4.8%, which is about 2/5 of the rate in Chicago, Naperville, Elgin area, and about 2/5 of the rate in Illinois, which is 11.8%. Now, according to the Illinois Department of Employment Security, in Woodridge, the unemployment for March of 2024 was 3.6%, while in March of 2023 it was 2.8%. And similar things were happening in Westmont, where the unemployment for March of 2024 was 3.6%, and for March of 2023 was 3.0%. So we can conclude that the unemployment rate is going up. Now, looking at safety in terms of fire, from the website of the Lisle Woodridge Fire District, it is said that its primary mission is to provide a variety of services designed to protect the lives and property of those people within the district. from the adverse effects of fires, sudden medical emergencies, or the exposure to dangerous condition caused by man or nature. It has two stations, number 52 and number 53, that are within the village limits, where number 54 and number 55 are in Lisle, which is the neighboring village. To meet this mission, the fire district employs some of the country's highly skilled and trained firefighters and paramedics. Since 1993, the fire district has maintained an Insurance Service Office's Class 1 rating in 2019, and the fire district earned accredited agency status from the Commission on Fire Accreditation International, and these agencies are often described the Woodridge community as being community-focused, data-driven, outcome-focused, strategic-minded, well-organized, properly equipped, and properly staffed and trained. Now, looking at safety in terms of police, the Woodridge Police Department provides a full array of law enforcement services: a tactical unit, a traffic unit, a crime prevention unit, and a GRIT unit, which I had to look up, was a gang-related information tracking unit, records, and community service officers. The police department has just been put into a brand new building that was dedicated in 2024. It also has a information portal, which is a resource that community members can get at through the internet, that shows crime information, safety tips, and it is done on a dynamic map of the village of Woodridge. Features include engaging videos, crime trends, traffic incidents, service calls, and content is also in Spanish and more. Now we want to look at crime data, and according to the Village of Woodridge Police Department, crime data is divided into Part 1 and Part 2. Part 1 crimes include the most severe crimes impacting society, including homicides, thefts, and assault. In 2021, there were 324 Part 1 crimes committed in Woodridge. Part 1 crimes decreased by 45% in 2021 as compared to a decade ago. Part 1 crimes continue to fall significantly compared to 1990, when the Part 1 crimes were 1,043. Now, Part 2 crimes include controlled substance violations, vehicle offenses, vandalism, and are generally less serious than Part 1 crimes. That's according to the FBI. Part 2 crimes in 2021 increased by nearly 8% as compared to 2020, and we'll see in the next slide what that translates to. Something that I actually learned that I did not know was about thefts that occur from a motor vehicle versus burglaries from a motor vehicle. A theft from a motor vehicle is when something is stolen from the outside of a vehicle, such as a catalytic converter or a hubcap. Theft from a motor vehicle is different from a burglary to a motor vehicle because burglary occurs when something is stolen from the inside of the vehicle. Woodridge saw a sharp increase in thefts from motor vehicles from 10 in 2020 to 52 in 2021, mainly due to catalytic converter thefts. To help prevent catalytic converter thefts, you should park it in a garage or a well-lit area, install a security camera, or etch the vehicle's VIN number or license plate onto the converter. Actually, you can remove a catalytic converter rather quickly, and thieves can get $50 to $250 per converter, and it can cost you from $2,000 to $2,500 to get it replaced. So as you can see, the theft from a car in Woodridge has gone up 420% from 2020 to 2021. Now, as far as safety in terms of the Environmental Protection Agency, we have to look to the state. And the mission of the Illinois EPA is to safeguard environmental quality consistent with the social and economic needs of the state of Illinois, so as to protect health, welfare, property, and the quality of life. The Illinois EPA works to safeguard natural resources for pollution, to provide a healthy environment, and by partnering with businesses, local governments, and public, the Illinois EPA is dedicated to continue the protection of the air we breathe, the water we drink, and the land we live on. Now, Woodridge of Illinois produces a water quality report that can be accessed through the Village of Woodridge website. As far as transportation goes, you can see that the mean travel time to work is about 31.2 minutes. 69% of people drive alone, 8% of people carpool, 5% take public transit, nobody rides a bicycle, nobody walks, I guess, to work. Other modes of transportation, which I don't know what that might be, is 1%, and 17% of people in the village work at home. Now, there's an extensive PACE bus system where you can get transit to the Lisle Metro train and to the Belmont station, which is in Naperville, so you can get to downtown if you need to work or shop or go to plays and things. There's also bus service to Joliet, Lewis University, which is in Romeoville, Good Samaritan Hospital, Bolingbrook, Yorktown, and Downers Grove. So you can see there's an adequate bus system, and that connects with trains in the neighboring villages so people can get around. When looking at education, you can see that 93.6% of Woodridge has a high school grad or higher, and it's a little higher than the rate in the Chicago, Naperville, Elgin metro area, which is 89.7, and a little higher than the rate in Illinois, which is 90.1%. 47% have a bachelor's degree or higher, about 20% higher than that Chicago, Naperville, Elgin metro area, and about 1.3 times the rate of Illinois, which is 36.7%. Now, in looking at the education for children within the Village of Woodridge, there are actually 6 elementary schools and 1 junior high school. Now, remember, I told you before that the Village of Woodridge shares a high school with Downers Grove. So there's actually an adequate number of schools to provide education for our children. Now, as far as government and politics goes, Woodridge is actually a village. It has a village administration, which advises the village board on present and future financial and personnel and program needs, implementing immediate and long-range village priorities, establishing procedures which will assist the village in serving its residents, preparing an annual budget, and supervising village department managers. It has several divisions, which consist of human resources, information technology, a village clerk's office, risk management, cable services, legal services, legislative, and general management. Now we're going to look at communication within Woodridge. One of the big concerns is computers for household, and as you can see, 97.2% of families within Woodridge have a computer, versus Darien, which is 96.6, which is about the same, versus Kankakee, which is a city in the middle of Illinois, which is only 88.4%. Households with broadband internet is 94.6 in Woodridge, 95.4 in Darien, and 79.3 in Kankakee. Now, the types of language that were spoken at home in Woodridge is English only is 68.7%, Spanish is 11.9%, other Indo-European languages are 10.1%, Asian and Pacific Islander languages are 5.9%, and other languages are 3.5%. And this, I think, reflects the community as a whole, which is becoming more diverse. Finally, we're going to look at recreation, and recreation in Woodridge is very bustling. They have over 1,000 programs. They have 5 facilities, including a park district, a recreational center, and a water park. They have 21 miles of paved bikeways that connect with regional paths and 40 community and neighborhood parks. Now, looking at the strengths of Woodridge, it is a very young and diverse community. The cost of owning a home is lower than some neighboring communities. It has adequate health care facilities, a high medium family income, adequate fire and police, and adequate transportation, education, and recreation. Now, looking at the weaknesses from our assessment of Woodridge, is the population is declining. Heart disease is the leading cause of death. Opioid usage is down, but worrisome. The number of rental properties may be problematic for long-term stability. We need more long-term care within the village limits. The unemployment rate is up, and thefts from motor vehicles is also up. So what you would want to do is create 3 community diagnoses with the 3 priority problems that we can address. So I think from this list, I would probably choose heart disease because it's kind of within the wheelhouse of nursing, and also opioid usage, which is down but still worrisome, and possibly even looking at thefts from motor vehicles to see if education could be done. What you want to do is try to align these goals with the Healthy People 2030. And then you come up with solutions as how we will address these weaknesses for the village of Woodridge, and then also how you would go about evaluating them. So I hope this slide presentation is somewhat helpful for you, plus the fact that I posted up the example of student work from last semester or fall semester, so that you can kind of know what is going to be asked for you to do for this assignment. I would set up a bit of time for this because it did take me a long time to sort through the data for the village of Woodridge. So what I'm telling you is don't do this the night before.